Hello, my name is Sunil Mishra, and this is the Module 2 portfolio assignment for HC 4620 Healthcare Method and Prognosis. So, in this assignment, I have been asked to pretend as a, as a part of the informatics and analytic unit for local health department, which is in a rural town, and prepare strength, weakness, opportunities, and threat analysis regarding the health information exchange systems for my employer. So, further ado, let me go to the next slide where I have tried to put together the strengths, weakness, opportunities, and threats facing to my department or my organization, which is the local health department. So, what I see here for my local health department strengths are are most of the rural communities are very tight knit. They have a most of the providers have a personal relationship with the patients where they know each other. That's having a strong relationship helps a lot, where the doctors can talk to or providers can talk to the patients very easily and their comfort level is very good. And very important, we all know the rural community doesn't have ample of resources. So the local health department in a rural community, they pretty much know how to work with limited resources, and they're highly dependent on Medicare and Medicaid. Let me elaborate this point where I'm telling highly dependent on Medicare and Medicaid. So, what I see here is that kind of they have a kind of single payer, right? If they go to the open market, there could be more innovations can come where the payment, the simply they're not Medicare is paying for services instead of the quality of the services, where we can go to the personalized medicine and where we can see the quality of care, right? Payment is tied to the how much how much provider is working hard to make a patient away to visit him. Maybe they know each other very well, but they don't want to see each other, right? I don't want to see the doctor unless I really sick in that terms. And being a tight net, they do develop a very strong local leadership. So these are the strengths. Now let's look at the weaknesses. So when I look at weaknesses, I see the limited resources. We all know the how the local health department in rural area is the lack of resources, not enough clinics. The clinics are shutting down. They don't have a money to run that. They don't have money to provide the services. Access to healthcare. What does this mean? Because here, what I'm trying to say here is that as a patient in rural community, reaching to the doctor is very difficult. I have a personal story here to share. My daughter is doing a BS in public health, and she happened to do some research, and she was doing research at the university hospital, and what she found out that people are driving 40 to 50 mile to see that regular pregnancy checkup, like which every month you have to do. So imagine how much hardship they're taking, like one way driving for 40 miles or 50 miles to see their regular monthly uh, pregnancy checkup for the females, right? Which is, you can understand how hard is the access to the healthcare. And a very important part, due to the limited resources, most of the systems are not interconnected. So as you can see that That means we don't have opportunity to collect the data in health exchange. And if we don't have the data to be collected, it's going to be hard for us to provide the precision medicine or precision public health, or as a Professor Rachel has mentioned, like public health is kind of a good connection. It is for a public, but individual is also sharing to that public, right? We are a part of that public health care. So if that my information is being shared into the pool, that's gonna provide the good results, can be provide the good analytics based on that information. And as I say, most of the coverage is by the Medicare and Medicaid. So if people don't have Medicare and Medicaid, that means they don't have any insurance. So that's the pretty big weakness there. And what are the opportunities we have? Like these strength and weakness are presenting us the very great opportunities where we can improve our local health system, where we can redefine the education system, where we can provide by redefining the education system. If we have educated population in the town and rural area, obviously the company is going to be coming closer to that to tap that educated pool. And other is like improving the job satisfaction, because as you know that nobody wants to work in the rural health department. Like whoever is working, I think we have to retain them, we have to make them happy, we have to provide them such environment they get satisfied with the job, because obviously they have some passion, that's why they're working there. Because otherwise they have opportunity to move to the urban area where they can make more money, they can have a better life for themselves, but definitely they have a good passion for their local community, that's where they're staying there. And a very important one is integrate the local health department with health exchange information, where local informations and they can share the pool of the analytics and data which is provided by the other areas of the healthcare also, like from urban. They can find a pattern and they can develop better strategy, or even they can understand from a different rural area where the things are working much better, and they can have that opportunity and try to adopt those systems or mimic those systems. And a very important one is a telehealth network where, as I said, the access to the healthcare. Imagine that same situation where the patient don't have to drive for 40 miles. She can go to the local system where they can have a telehealth system where the doctor can be on the video conferencing and imaging services are available, where the doctor can see that patient remotely, where the patient don't have to drive for 40 miles, which is like almost hour drive. I don't know what kind of roads are there. Like if it's secondary road, obviously I'm talking about 1 hour to 1.5 hour drive. And in that condition, when you're pregnant, as the days will be closer to delivery, you can understand how difficult it's going to be. And then very important was a data driven healthcare, where if we connect our local health department to HI, where we will be collecting the data, we'll be part of the big data pool. So we can take the data and the data can drive our healthcare to improve the satisfaction into our population. And threats which we don't control, it's external threats, like which the as my department have a no control on that, like a physical physician shortage which we can't control. Yes, we can provide the good opportunity, good satisfaction, maybe that can improve that, but we don't have much control on that. Economic hardship, like where the jobs opportunities are not there in rural environment, mostly they're farmer or very low kind of very they may be, most of the people will below poverty line. So there's a very much economic hardship is there, and that could drive them not to see the primary care because due to the financial reasons, right? And infrastructure which we don't control, like good roads, infrastructure to connect to broadband. Like if they have a broadband services, maybe they can do the video conferencing with the doctors, they can do some research on the internet and find out their symptoms where they really need to go to the emergency room, or they can manage their care, or they can consult the doctors or nurses over the phone or video conferencing. And this is the problem with whole US healthcare system, where the cost is rising in very uncontrolled fashion. And other thing is like how the public park and public utilities walkways are available, where that can make the population healthy, right? Where I have a park, I have walking trails where I can go and walk or run, where I can do the physical activity and try to be healthy and try to lead the healthy lifestyle. And maybe we need to have a good healthy choice restaurants and choice of the food. This all those things matters, because if individual person is trying to be healthy, as Dr. Rachel is mentioned, I'm part of the population. If I keep myself healthy, definitely I'm impacting the whole population of the healthcare, right? And the as mentioned, prevention is better than cure, right? So these are my findings, and hopefully I was hitting on the point. Thank you very much.